South African children are spending more time in front of a screen than what is recommended. Well, a study by 30 experts from 14 institutions has found that 9 out of 10 children spend over 3 hours a day in front of a television screen. Now, according to the report, this habit also has a negative impact on a child's weight. For more on this, we're joined via Skype by the director of the Center for Health through Physical Activity, Lifestyle and Sport, Vicky Lambert. Vicky, thanks very much for coming through. Perhaps let's start by you giving us a bit of a background to the report, how it came about, what prompted the study.
Thanks, Boyo. Very nice to be here this evening. The Healthy Active Kids Report Card, South Africa, is the 5th in a series, which we started in 2007. And it's actually part of an international initiative. And in fact, this year, over 49 countries actually participated worldwide. And it's a chance for academics to actually take the best available evidence, the scientific evidence. So it's not a study on its own, but it's a way of gathering the evidence so that we can create an advocacy document to government, to parents, to the private sector, to non-governmental organizations, to try to mobilize people to improve and to create activity-permissive environments for our children and youth, and to actually look at the food environment and how we can help them to make better choices.
Now, according to your report, the fact that they are spending more time watching television is actually bad because it has got a negative impact on their weight. Is that the only concern that you have around the impact of them watching more television than is recommended?
Remember that the focus of this report is really on physical activity on the one side and on healthy eating and body composition or body weight appropriate for body height. So we're concerned about a number of things. Firstly, none of the indicators since 2016 have improved. And in fact, several indicators have actually gotten worse. And what's important is that South African children, in fact children globally, need to actually try to accumulate at least 1 hour of physical activity per day and less than 2 hours of screen time. And you have reported on the very startling statistics around screen time. And when we think of preschoolers, for example, they need 3 hours of activity per day and less than 1 hour of screen time. So what we're seeing, Boyo, is a worsening of the policy implementation gap in schools. So the indicator in schools has actually dropped over this two-year period because physical education and physical activity are not being implemented as intended. In fact, only 1/3 of South African children are actually participating in physical education in schools. And what's so remarkable about that is that we know that when physical activity and physical education take place in schools, academic achievement is better.
But where are the gaps? What is actually responsible for that deterioration in standards or the lack of implementation of policy that you're citing?
I think, we've spoken to educators, and one of the challenges is that there's a big emphasis on the so-called learning subjects without actually recognizing the importance of physical literacy and movement as part of that repertoire of learning. We've also seen that the National Sport and Recreation Program, which actually focuses on the National School Sports Program, there seems to be a kind of limited implementation and very little by way of evaluation. So we have the challenge in that it seems as if at a local level, educators are not being motivated to actually implement physical education. And at a national level, there seems to be sort of a lack of cohesive support. So that's on the one side. But it isn't just about schools. It's also about, for example, communities. And one of the challenges is that our children lack safe places in communities to participate in physical activity. And so one of the recent initiatives is something called Play Streets, in which communities actually gather together with local government and local NPOs, and they're working with the city and with provincial government. They block off the street so that children have access to a safe area to play on a regular basis. But that takes community members and parents and people to actually invest their time. We also, I think, in terms of the school can be the center of the community because most schools have actually got physical activity resources in their environment. And this is successful in a lot of lower and middle income countries.
Okay, I carried on the role that obviously municipalities would then have to play to provide these play streets for the kids, and I suppose, or I'd imagine, then parents who are the ones who would then have to get the municipalities to provide these facilities. But I want to take you back to the point you made just before that one. One would have thought that the results of children's, after exams would then show that indeed, they are spending more time studying than playing, for example. But if the public schools, outcomes are anything to go by, that isn't necessarily the case.
And you're absolutely right. I think, again, we sort of privilege the so-called learning subjects, and we actually completely don't consider physical activity and physical education as part of that. But I can honestly say there is irrefutable evidence that where physical activity and physical education, even in low-income settings, in countries where resources are limited, is implemented as intended, the academic performance is better. And the other aspect is that our children spend so much of their academic day or their daily time in school that the school food environment is also problematic. So even though we have, for example, national tuck-shop guidelines, these really aren't being observed in schools. And often schools are dependent on that income for buying some bread and so on. So it's a matter of trying to make healthy food available at a price that youngsters can afford, because most of the children, over half of the children, are bringing money to school to buy food at school. So there needs to be a more strong regulation of that environment as well, and to encourage the access and prioritizing a healthy food, as opposed to, our children in South Africa, Voyo, actually have the highest intake of sugar-sweetened beverages across 12 countries, including two African countries and many lower and middle-income countries.